In general, the term liposuction for most of us means a cannula, which is about the size of a pencil, that is placed underneath the skin and has multiple open ports through which suction removes the fat. Candidates for liposuction include both male and female. The typical age group is going to be from 17 or 18, most people who have surpassed puberty, until the ages of 60. High school students that seem to be out of the typical ideal body weight, who have developed an exercise program and a dietary caloric program, can be candidates as an adjunct to their medical therapy. Those of us that are just a little bit out of shape, who have begun to develop a global program for calorie maintenance and exercise. I had one patient well into her mid-60s who just felt uncomfortable in the sitting position, and so we were able to give her more comfort by just removing the adipose tissue of her abdomen, and she was very, very pleased with that outcome. I typically add Vaser, which is ultrasound-assisted liposuction. That helps emulsify the fat through cavitation, and then also generates heat under the skin so that there's more skin contraction with the liposuction. So I would treat the patient with the ultrasound and then remove the adipose tissue afterwards. Another device that's I've utilized is radiofrequency in the form of body-tight. So that's using electrical energy to achieve even more skin contracture. So patients who have had even more lax skin that may have been limited to abdominoplasty or surgical excision of the adipose tissue may be a candidate now for minimally invasive fat reduction with using the body-tight. So I have an example of that I can show you. So this would be a device that's typical. This probe is in the subcutaneous tissue. This is external to the skin. The radiofrequency transfers between the two, and the skin and subcutaneous tissue and the fibrous septa that are in between can contract, much like a piece of bacon might do if heat were generated. I've also used liposuction for breast reduction in several patients that really didn't want to have surgical scars on their breast. And so with the contraction appliances or surgical devices that I've mentioned before, in conjunction with liposuction, I've been able to reduce female breast slightly. It's not going to replace true breast reduction for large women, but it is an option for those who may be an appropriate candidate. Likewise, in males who've developed gynecomastia, or some people say moobs or male breast, there are a variety of things that typically cause that. Usually it's idiopathic. It's unclear exactly what causes the development of male breast in the general male, but it could be associated with puberty in the young male. It could be associated with certain medications. It can be associated with cannabis, and may also just be associated with hormonal imbalances. But individuals who are above their ideal body weight may also develop breast. In this particular instance, the Vaser or ultrasound-assisted liposuction is the treatment of choice for the male because it causes contraction of the skin and emulsification of the fat, and then the fat can be aspirated as well. Sometimes there are male patients with large breasts that require excision and repositioning of the nipple-areola complex, but usually the breast can be treated at least with a trial first of liposuction or ultrasound-assisted liposuction. I really try to encourage my patients before they do any kind of body contour procedure, and especially liposuction, to have maintenance of baseline exercise program that involves something that's non-traumatic but is utilizing calories on a daily basis, that they're trying to achieve as best they can their ideal body weight. It's important too that people learn to sleep as much as possible. If they're having if they're having sleep periods of less than 7 to 7.5 hours in most people, 2 hormones are released, and this could cause them to retain weight. So I really try to counsel them to just consider the body contouring procedure as one portion of their health maintenance program.